Coronavirus are a large family of viruses that cause illness starting from the common cold to more severe diseases such as Middle East Respiratory Syndrome and Severe Acute Respiratory Syndrome. This virus is zoonotic, that means they are transmitted between animals and humans. A new coronavirus was identified in late 2019 in Wuhan, the capital of China's Hubei province, after people developed pneumonia without a clear cause and for which existing treatments were not effective. The virus has shown evidence of human-to-human transmission, and its rate of infection appeared to increase in mid-January 2020, with several countries across Europe, North America, and the Asia-Pacific reporting cases. The incubation period is between 2 and 10 days. There is evidence that it can be contagious before the onset of symptoms. The common symptoms include fever, coughing, and breathing difficulties, and it may be fatal. The virus has come from various animals. People who initially were infected either worked or frequently shopped in the seafood wholesale market in the center of the Wuhan city. The virus has come from various animals. New and troubling viruses usually originate in animal hosts. Ebola and flu are other examples. Severe acute respiratory syndrome and Middle Eastern respiratory syndrome are both caused by coronavirus that came from animals. In 2002, SARS spread virtually to 37 countries, causing global panic, infecting more than 8,000 people and killing more than 750 people. MERS appeared to be less easily passed from human to human but has greater lethality, killing about 2,500 people who have been infected. The virus causes pneumonia. Those who have fallen ill are reported to suffer cough, fever, and breathing difficulties. In severe cases, there can be organ failure. As this is viral pneumonia, antibiotics are of no use. The antiviral drugs against flu will also not work. Recovery will depend on the strength of their immune system. Many of those who have died were already in poor health. Human-to-human transmission has been confirmed by China's National Health Commission, and there have been human-to-human transmission in the US and also in Germany. As of 5th February 2020, the death toll has climbed to 490 in mainland China. There remains one additional fatality in Hong Kong and one in the Philippines. There are 24,500 confirmed cases around the world, with almost 23,000 being in mainland China. The mortality rate stands at 2.1%. The number of people to have contacted the virus could be far higher, as people with mild symptoms may not have been detected. Modeling by World Health Organization experts in London suggest that there could be as many as 100,000 cases, with uncertainty putting the margins between 30,000 and 200,000. Experts don't yet know how dangerous the new coronavirus is and are unsure until more data comes in. The mortality rate is around 2%. However, this is likely to be an overestimate, since many more people are likely to have been infected by the virus but not suffered severe enough symptoms to attend hospitals. For comparison, seasonal flu typically has a mortality rate below 1% and is thought to cause about 400,000 deaths each year globally. SARS had a death rate of more than 10%. Another unknown key, of which scientists should get a clearer idea in the coming weeks, and how contagious the coronavirus is. A crucial difference is that, unlike flu, there is no vaccine for the new coronavirus, which means it is more difficult for vulnerable members of the population, especially for elderly people or those with existing respiratory or immune problems. Hand washing and avoiding other people if you feel unwell are important. One sensible step is to get the flu vaccine, which will reduce the burden on health services if the outbreak turns into a wider epidemic. Health experts are starting to say it could become the worldwide spread of a disease. Coronavirus cases have been confirmed in about 25 countries outside China. By far, the majority are travelers who picked up the virus in China. The spread of the virus outside China is worrying but not an unexpected development. The World Health Organization has declared the outbreak to be a public health emergency of international concern and says there is a window of opportunity to halt the spread of the disease. The key issues are how transmissible the new coronavirus is between people and what proportion become severely ill and end up in hospital. Healthcare workers could be at risk if they unexpectedly came across someone with respiratory symptoms who had traveled to an affected region. Generally, the coronavirus appears to be hitting older people the hardest, with few cases in children. Several countries are trying to rescue their citizens and diplomatic staff from the area, primarily through chartered flights of the home nation that have been provided clearance by Chinese authorities. Several countries are trying to rescue the citizens and diplomatic staff from the area mainly through chartered flights of the home nation that have been provided clearance by Chinese authorities due to the effective lockdown of public transport in Wuhan and Hubei province. The government are also providing medications to those needed even with mild symptoms. Huge organizations such as Direct Relief and many other governments are donating money and providing necessary material in order to avoid the virus and cure for those affected already. However, special hospitals are constructed by Wuhan province in order to cure the suffered patients. Airports in Malaysia, India, US and Australia has started thermal screening for all passengers and flight crew who are arriving from China. In addition, medical bays have been created to quarantine passengers who may show symptoms of the virus infection. The arrival gates for Chinese flights have been reallocated closer to the medical bay to ensure quicker action against the spread of the virus. Especially Los Angeles International Airport in US has set up bipolar indoor air quality technology to limit the spread of the disease in the airport. The technology consumes and attacks the poor air, replacing it with clean air. If you like the video, hit the thumbs up and do not forget to share the video and subscribe our channel. Hit the bell icon to receive daily new videos.